my name is Rochelle Rocha and I'm your friendly neighborhood pharmacist. Today I'm introducing you to a very important symbol. This is the point of care symbol, and this will be found in every pharmacy in Ontario. Every jurisdiction will have a symbol like this in their window, and what that tells you is that this is legitimately a regulated healthcare professional's place of business. And the regulator is the organization of the government that makes sure the people who work in there are competent to practice. So the pharmacists and the pharmacy technicians are regulated members of the public. And when a person is regulated, that means that they've met some minimum threshold for educational requirements and they've demonstrated their competency to practice. Places that are regulated, like the pharmacies, get visited by inspectors from time to time, and they're looking for some things that you care about. Number one, they want to make sure that our supply chain is clean and fresh. What does that mean? It means that there's an expiry date on every medication. Just like when you go to the grocery store and you can tell that you need to buy things that aren't expired because they're going to be safer for you. When a medication gets expired, it is not as potent as when it is fresh. And so one of the things that happens in the regulated pharmacy is that there are systems in place to ensure that we have a fresh supply. One of those systems is once a month, the pharmacy staff will go through the shelves and they will pull any products that are expired. The other system that happens is as we are filling prescriptions, we are obligated to write down the expiry date. That could be done in our computer software, so you can't finish completing the prescription until the expiry date is entered into the system. And if the expiry date is going to be during the time that you're supposed to be consuming, the computer will flash us a big red symbol and say, stop, this medication is going to expire before the patient will have time to use it. What do you want to do? And so what we normally do in that situation is that we won't use that supply and we will go get a fresh bottle and use it there. The other place that's regulated is the controlled drugs and narcotics. So we have narcotics safes that are time delayed. And the reason we do this is to keep the public safe so that medication that isn't intended for consumption by people who aren't prescribed it doesn't get out there. We have security systems in our pharmacies. We have safes that are time locked. The other place that we have some controls over is refrigeration. So many medications are refrigerated. Insulin is one of them. Many vaccines are refrigerated, things like Ozempic and Mounjaro. So there's a lot of different kinds of medications that require refrigeration. And so there are regulations in place that ensure that we're using proper medication fridges in our pharmacies and that we're monitoring that the cold chain gets protected. And that means also when the supply comes to us from the wholesaler, it comes to us under refrigeration and it gets stored under refrigeration. So having a regulated professional in charge of a regulated place ensures that you get a safe and effective medication supply. One last thing about expired and unused medications, because you probably have some at your home. Probably in some cabinet you have medication that is not being used, and if you looked at the expiry date, you would be surprised to learn that it expired 5 years ago. You shouldn't be carrying that stuff in your house anymore. What you need to do with those kinds of products is you need to bring them back to the pharmacy, and we have a special disposal for expired medications and unused medications. And we will get those brought to a facility which will environmentally friendly way get rid of those items for us. We can all keep our communities safer and cleaner by bringing those items to the pharmacy. So that's kind of my little short story about the regulated practice of pharmacy and the pharmacist who's in charge of that and the registered technicians who are in charge of that, just to give you a little bit of understanding what we do kind of in the background that you never see when you just get that little bottle in your hands. Please bring your expired and unused things back to the pharmacy in your neighborhood.